Hello, friends. Welcome to the Ancient Health Podcast, where East meets West. I'm your host, Dr. Chris Motley. I'm here at HOS, and I just became really good friends with Dr. Amie Hornaman, and we met at the conference, and you have really great content, and one of the things I really appreciate is not only like with metabolism and hormones, with ladies' hormones, but you also delve into the emotional side as well. And you could tell that you like try to get at every angle. But I just want to say, first of all, thank you so much for joining me today.
Oh my gosh, I love you back, and we're gonna have a great show.
We're gonna have a great time. Okay, so I do want the people out there to know more about you because we talked that you're from Des Moines, Iowa, which I was raised partially in Kansas. But first of all, tell us more about yourself, though. I love knowing about you.
Okay, well, I am Dr. Amie, aka the Thyroid Fixer, and I'll tell you that story of how that came to be in a minute. But yes, live in Des Moines, Iowa, but we have a virtual practice. So because of my story of being misdiagnosed multiple times, I was walking around with a thyroid problem, was told you're normal, everything's fine, just eat less and exercise more. After going through that very frustrating hell, I made it my mission that I wanted to be able to help women and men everywhere in every single state. So I wanted to build a practice where we could prescribe the right thyroid medication, the right hormones. And I know we're going to dive more into that, but that was my mission from the beginning. And that's what we do now. So I have a virtual functional medicine clinic where we do all of that. We just treat people the right way.
I love it. And so when you do the thyroid fixing, it truly, like there is, in my opinion, more prevalence of thyroid dysfunction and impairment and imbalance this day and age because of stress. Are you seeing it, maybe this is a little too vague a question, are you seeing equal across the board with men and women, or is it like with more
women?
More women.
So women just historically get hit with hypothyroidism and Hashimoto's, the autoimmune form, more than men. It really is about a 90-10 ratio. 90%
What?
10% men. Yeah. Wow. Yeah.
So
whenever I see dudes get hit with hypo, I'm like, oh, I feel so bad for them because ultimately their testosterone will tank.
Yeah.
It'll tank.
No
right
testosterone.
Thyroid, yeah. So guys get hit with hypothyroidism and now they have very low testosterone levels. They really suffer.
Wow. What if some people out there listening would say, because you already showed in such great posts, but what are your main signs and signals you would say, you hear last that signs and signals that you would say you need to look out for for women to look out for to know you may have a thyroid issue?
Oh, I love this because I always tell my audience and my patients, it's your symptoms plus testing. So we pair those two together, but you have to start with the symptoms. You have to start with how do you feel? So it's weight gain, inability to lose weight, hair loss, low energy, constipation. And then we can even get into joint pain, muscle pain, different arrhythmias, heart palpitations, intolerance to cold or heat.
Really?
Because the thyroid is the master gland.
Yeah.
So it's controlling everything. But I would say weight and energy and hair are the top three.
So when you have those three, because I have patients that come in and they'll say things to me about their heart, and they'll say, hey, I've been having heart palpitations and I'm staying pretty fatigued all the time. And that would be like your indications. When you start to see that they do get the testing, they have lower in the normal range, how do you treat that? Because there's this whole discrepancy about it being close to being out of range, but it not being out of range.
Right. So they use the term subclinical.
Subclinical.
Which I always tell people, listen, if you've heard the term subclinical, then you have a thyroid problem. Because that means that you have low markers, even in conventional medicine. So now in functional medicine, we come in and we look at it totally differently. We say, okay, you know that standard lab value range next to each test. That's taken from a group of sick people. We don't want you in that wide, vast group of sick people range. We want you over here in the optimal range. And what functional medicine does, I would say we come in, we look at the badasses. You know, we look at those 75-year-olds that are still skiing down the side of a mountain.
Yeah.
And we look at the 65-year-old dude that still has muscle or the chick that still has this beautiful shape to her. And we go, you know what? Let's test them. And that makes that range a lot more narrow. Now it's more like a little bullseye that we want you to land in because we know that's where you're going to feel your best. That's where you're going to be optimal.
Wow. See, now when you say you do the optimal range, because they say there's a range where they can't get the limits or the ranges from sick people because they're just testing people that are in like sick states, basically.
Right.
Wow.
Right.
Do you find with thyroid, have you found that there's any like infections? Because I'll see that they'll say there's not a coincidence, like there's Epstein-Barr or herpetic viruses that are with the thyroid. Is that a big thing?
That's a big thing. Yeah. So when I go through the triggers of thyroid dysfunction, like what actually causes hypothyroidism or causes Hashimoto's, one of the big things is fluctuating hormones. So pregnancy, perimenopause, menopause, that will flip that switch in a heartbeat. And then we move down the line. We go, okay, were you on birth control for more than 10 years? That increases your risk by 243%.
What?
243%. It's craziness. Birth control, 10 years. That was me. 100%. I did it. Many women did.
Yeah.
I didn't know any.
You didn't know it. Yeah.
Didn't know any better. Then we go into underlying infections like EBV and Lyme. And those can absolutely set someone up for hypothyroidism. And I don't know about you, but I have not yet met a person that doesn't have Epstein-Barr virus. It's like, did we all get mono at some point? I'm pretty sure we did.
I'm pretty certain we had to, because like I've had some testing later in life and they're saying like my EBV signals were high. My mom had it off the roof.
Yep.
And I know my dad does. And you're starting to see like infections getting into the thyroid, starting to get into the throat. I want to go back to like not being able to lose weight, because that's one of my main concerns for my patients. Like I can't lose weight.
Yeah.
And that's one of your things that you tackle a lot?
It's big. It's big. And especially as a woman, you know, when you're walking around with that extra weight, or for anyone, when you're trying, when you're doing all the things, you've cleaned up your diet, you eliminate the seed oils, you eliminate the sugar, you're getting to the gym, you're doing all the things. You're like, why am I even doing this? It's not working. There's not a damn pound that's coming off of you right now.
Yeah.
And that's just so frustrating. But that really is pretty much one of the number one
things that they come to you.
Signals and symptoms of hypothyroidism. Yeah.
When you see it though, like, are you, what's one of your favorite, I know it's a thyroid test, but do you have any favorite labs that you like to work with, or you have one in particular? Do you do your own testing?
So we just order our own because we can run it through insurance. So I'm fine with running it through LabCorp, Quest, whatever, because at the end of the day, we're going to look at those numbers from a functional point of view. So just give me the feedback, give me the results, give me the data, and then we'll figure it out from there. So free T3 and reverse T3.
Okay.
Those are the two most important thyroid markers you can test for. In fact, I don't even care if you leave off TSH and free T4, which you and I know, those are the main tests that you'll get every single time you ask for a thyroid panel. Your conventional medicine doc all day long will order TSH, all day long will order free T4, the inactive thyroid hormone. Wait a minute, why don't we test the active thyroid hormone? Because that's what's going to give you a metabolism. T3 is what gives you a metabolism. I want to know how much free T3 you have. And then I want to test that reverse T3, because that is that marker of conversion, which we can get into. But I want to test free T3 and reverse T3. Those two are the most important. And then, of course, we look at the antibodies as well. I want to know if it's Hashimoto's. Because most of the time it is.
Yeah.
So we want to see, you know, just get that baseline marker, how many antibodies you have as well.
I love this, like when we talk about antibodies. Now, for people who don't know, which antibodies are like the TPOs?
TPO and TGA, thyroid peroxidase and thyroglobulin.
So that would give us an indication that the body in some ways attacking your own thyroid.
Exactly. And here's the other thing for your listeners. Any antibody is an antibody against your thyroid. I teach this all the time. I have women coming up to me at the show and they're like, wait, what? I have Hashimoto's? I'm like, right, because you have 21 TPO antibodies. Yeah, I know the cutoff over here is 34, but what are we going to do? Are we going to wait till you get to 35 antibodies that are attacking your thyroid when you have 21 right now? 21 antibodies are going on a daily basis and beating up your thyroid gland. So if we wait till you hit 35 antibodies, you might be 10 pounds heavier, not able to think, not able to get off your couch. Let's address it when we see it. So any antibody is a marker that is attacking your thyroid.
Okay, I got to write that one down when we get done here, because when you start to see that, the great thing about this is that people out there who can't lose weight, there's grace for yourself. Like, you may not be able to lose weight, but there are answers, like you have an antibody that's working against it. Do you find too, when people get up, they have this thyroid issue and they come to you and they're like distraught? Like, do you believe that the emotional fatigue drives it, or it could be both? Like that is the result of?
I think it can be both. I mean, we know that our thoughts, our emotions really drive our health. I mean, there's so much evidence to that right now. And that we can make ourselves sick, we can make ourselves well. Now, I'm not saying that you can think your way to a beautiful functioning thyroid if half of it's gone because you've been dealing with Hashimoto's for 20 years, right? But we do know that there's a there's a direct correlation with cortisol and adrenal function in the thyroid, where the thyroid, or specifically T3, needs cortisol and cortisol needs T3. So
Really?
it should be that balance. So to your point, if we're in this chronic stressed out state and we're driving our cortisol through the roof, that's going to hinder that conversion of the inactive to the active. That's going to hinder your thyroid gland from producing T4 and T3.
Wow.
So yeah, there's a strong correlation between emotions of any kind, specifically stress, and thyroid function.
So when you say cortisol, like let's say you get stressed out on the stress ball, and I drive cortisol levels pretty high, and you're talking about conversion, because some individuals may not even know what the conversion. So you're saying a conversion of one of the thyroid hormones to another one?
Yeah, let me break that down. So our thyroid gland produces two hormones, T4 and T3. T4 is inactive, meaning you don't have a receptor site anywhere in your body for T4.
Okay.
It has to convert and become T3. That's the active thyroid hormone. So that is what it's like a lock and key. So that T3 is the key that attaches to that perfect lock and turns it on every single cell. So it's turning on your metabolism. It's lighting up your brain. It's giving you energy. It's letting you poop every day. All the things that the thyroid does, you need that free T3. So you need T4 to become T3.
So you take the T4, it becomes a T3, and that will attach to your cells to drive all your metabolic functions and your pooping. And now, how important is, for everybody out there, they hear about iodine. Iodine getting into your thyroid. What's the key with iodine?
Ooh, it's so controversial.
I want to know your point.
Yeah. I love it. So iodine, in our world, we really are split. I would say about 60-40, 70-30, where there's that 30-40% of practitioners over here that don't like iodine. I'm over here in the other corner going, why? Because if we look at iodine, it is antifungal, antibacterial. It supports our immune system. It's antiviral. So we already talked about viruses being problematic for the thyroid. Iodine helps your thyroid gland produce T4 and T3. Iodine helps convert that inactive thyroid hormone to the active.
Wow.
It helps with nodules and goiters. It helps with fibrocystic breasts and fibroids in the uterus. It is so beneficial. Why would we ever avoid it?
That's why. Is there this discrepancy? Like they've been told that it's no good for them?
I think it got a bad rep when practitioners were using it in really high doses, like really high dose. So when I tell my patients start with iodine, I'm like, you start with like 2 milligrams and you work your way up to 5 or 6, and then maybe you make your way up to 12 or maybe 25. But some practitioners are using 50 and 100 milligrams on patients. Now, in some cases, like certain cancer cases, that's warranted. But if you give that to a patient and they start, right out the gate on this high dose, they could become hyperthyroid or have a thyroid storm.
Oh,
I think that's really where it got that bad reputation. But it's like that's one case out of every 200, 1,000, whatever. Just be smart about it and start slow.
Just like moderate it to what the patient would need. Because I wondered as well about how much iodine a person gets, because my mom's from Korea and they eat tons of seaweed. And until the injection of high sugar diets, because a lot of those cultures now have tons of sugar and preserved foods, unfortunately, like they got most of theirs from like sea vegetables and seaweed. Like it was a common thing. My mom would have seaweed soup when I was a kid. And she used to always tell me like, this soup is good for your blood. It gives you energy. Yeah. But we don't eat a lot of seaweed. Well, some people eat more seaweed nowadays, but we don't even see it in our diet, right? Like in our standard American diet.
Correct.
What are those things like you see in our standard American diet that would injure the thyroid? I know pretty much most things, or do you see something that's common with people with thyroid issues?
Well, I'm gonna keep going with the iodine based on that question. So the 3 biggest toxic burdens to the thyroid: chlorine, fluoride, and bromide.
Yes.
Let's look at the periodic table. We have those halogens that are right next to iodine.
Yep.
So iodine and those 3 toxins are all called halogens. They're all next to each other on the periodic table. When we look at a cell, there's a receptor site on it for all of those halogens. So the only way to push out fluoride, chlorine, bromide off of that cell is iodine.
No.
Iodine has to come in and say, hey guys, get out. I'm taking over. And iodine will attach to that cell instead, giving you protection, that viral protection, the the immune support, the thyroid support. We are so overexposed to fluoride. It's in our water.
Yeah.
I mean, there's fluoride toothpaste everywhere. Very few people have switched over to fluoride free.
Yep.
But then there's bromide. Well, it's in the pillows. It's in this couch. It's in that rug. It's on our clothes. If you live near a golf course, you're absolutely screwed. You're exposed to bromide all the time. And then there's chlorine. Okay, unless we all have the money to put in a reverse osmosis water filtration system in our whole house, we're being exposed to chlorine.
Truly. Like, and it's, so it can get on your, it can get into your cells, and you could put iodine in there to help push that stuff out.
You can.
And that's why I remember back in the day when I was like, they would tell me that, taking a bath in chlorine that's why it's so bad. Like, I didn't know why it was so bad. I'm saying, but now they said it could actually injure your cells. So that's the key. Wow. And so if iodine takes all that, those extra halogens and pulls them out, are there any avenues, and maybe I'm not trying to jump to one other area, but does red light help with like any of these, like helps the thyroid and protects it along with the iodine? Do you have any other types of modalities you like for the thyroid?
Yeah, I do like red light. I dove into it really looking at the research because I'm like, how is this really helping the thyroid? And I actually dove into the research wanting to find the contrary. Like, come on, there's no way that a light, right? Everything is positive. Like, legit, red light actually helps the thyroid heal, produce more T4 and T3. Now, can you just use red light therapy and not address all the other factors, not address the nutrients, maybe not even take your thyroid medication? No, that's not going to cut it. But it's going to help. It's going to help.
That's why. If somebody, is doing red light therapy, because I think my thought was going into, let's say they're into taking a bath in chlorine. Yeah. And I got fluoride. Okay. So they can't get a reverse osmosis. And would you suggest some of those patients probably would have to take more iodine, do different modalities to help offset that with the thyroid?
Definitely. So, there's the lifestyle things that we can do. Fluoride-free toothpaste is now more abundant, more accessible these days. You can get it at Walgreens or Rite Aid. So switch over. That's part one. Even if you just get like a 0 water pitcher for your drinking water, now you're removing fluoride and chlorine from the water that you drink. Maybe get a little screw-on shower head that, okay, it's not the best filter in the world, but my goodness, it helps a little bit.
Yes.
Change that filter out every couple of months. Little baby steps that if you can't afford the big, do those little baby steps, add in the iodine for the extra protection, and then let's move over here and really focus on what do we need to do for your thyroid balance. And if it's replacing thyroid hormones that are no longer being properly made, then let's go over here and do that.
That's great. Are there other supplements, vitamins and minerals that you like for the thyroid, along even with iodine? What's your top that really people need for their thyroid function?
Yeah. So we were talking earlier about T2.
Yeah.
And I've been studying T2 for about 15 years now.
Really? Yeah.
T2 is fascinating. I call it the forgotten thyroid hormone.
Yeah. I totally don't know anything about it. So this is great. Yeah.
This is good.
This is great.
New convo.
Yeah.
So T2 is the forgotten thyroid hormone. So when we look at the thyroid gland, it produces T1, 2, 3, and 4. We know T3 and T4, we talked about it, and those are in prescription medications. T1 is inactive. We can kind of set it aside, doesn't do much. T2, as it turns out, is very metabolically active.
Really?
So it acts like T3, but when we actually take T2, and it's available in supplemental form, we actually don't even need to beg our doctor for it. And like, please, doc, do the right thing by my thyroid and prescribe me, T3 or T2. We can get it in supplemental form. So that's why I put in my thyroid fixer, metabolism fixer when I first released my supplement line, because I had been using this for 15 years with my patients.
Wow.
Seeing tremendous results, weight loss like crazy. One woman lost 20 pounds in just 2 months of adding that in. And really just, cleaning up her diet and, walking a little bit more, kicking up her exercise. But it wasn't that produced the weight loss, because she'd been struggling with weight for years prior.
Wow.
It was adding in that T2 that boosted her baseline metabolic rate. So that's what it does, is it boosts your baseline metabolism, the amount of fat that you're burning at rest. It helps brown white adipose tissue. So we're all jumping in cold plunges, right? To brown that white adipose tissue, which then helps with insulin resistance. So it helps with that as well. And the fascinating thing about T2 is it leaves muscle alone. So it does not burn muscle. It only burns body fat. So these days, people are jumping on GLPs left and right to lose body fat, and it works. But as we know, we also lose some lean muscle mass with the GLPs. We are seeing muscle loss. And as we're aging, we cannot afford, well, no one can afford to lose muscle. But especially if you're in your 40s, 50s, 60s and above, you cannot lose that precious muscle because it's so hard to put on. And that is our organ of longevity. That's what's protecting us.
That's true.
So we have to keep our muscle and we have to lose the body fat to just be more metabolically healthy overall.
Definitely, because I've got to get in touch with you about the thyroid fixer because I know my mom would need that one heavily because we're talking about muscle wasting. And I'm not trying to shift it over to GLP, but I would say that some people are getting what they call like the GLP face, like that, like they're losing muscle because I've had some patients who've done it and they say they're looking great and they aren't, but you can tell they're starting to go past it. Is that what's happening?
Yes. Yes. And I've seen that as well.
Really? Yeah.
I mean, literally people losing their butt, losing their legs. They're starting to look anorexic. They have the Ozempic face sunken in. Okay. Now you've lost 20, 30, 40 pounds, whatever, but you look 20 years older than you actually are.
Yeah.
And that's a problem. And you've lost that protective muscle that's what's going to protect you. So, okay. Yeah. If you're 45 years old, you're probably not thinking right now about falling and breaking a hip and what's going to happen to you. But we know in the elderly population that you fall and you break a hip, you have a 50% chance of death.
That's right.
Just from breaking a hip. You go, well, what? I'm just going to heal from it. No, because you will become immobile and your risk of mortality increases by half. Yeah.
That's why when they talk about the Ozempic face, that's right, because I have seen that in the patients. They look thinner and there's a point where and I'm not picking on anybody. I think when people, like I'm naturally thin, I get it, you know, but when you see somebody who is losing a little bit more weight and you can tell like it's a little bit unhealthy weight when their face just really looks a little sunken in. And one of the doctors, I tried to just study methylation and things like that, trying to study pathways. And he was saying that you have to be very careful that when you get Ozempic, that you're trying to put the body into a fasting state and you have to have some kind of gradient, like you got to have a cutoff valve, but a lot of the time they're getting injections like regularly. Is that correct?
That is correct. And I'm a big fan of microdosing. I am not anti-GLP, but I think if you use it in the right dose and really get into that microdosing. Now, microdosing technically is not going to kick up a big weight loss condition. You know, when we use the normal doses, that's where we see the weight loss and then some that we're talking about right now. But the microdose, it will still work on your metabolism, but it'll work kind of beneath the surface, just very nice and slowly. But what we're seeing with the microdosing is reduction of inflammation, improvement in mood because it's working on the serotonin receptors. So there is benefit, but it has to be used the right way.
I get that because one of the patients, two of the patients, and I'm so thankful they came to me because they have a really great doctors who love like alternative medicine, and they were doing micro doses. And my part is like, I just do my best with like Chinese herbs to help their liver stay clean. And they would lose like 4 to 6 pounds and they were doing it healthily. And I said, man, my mood, like clarity is bigger.
Yeah.
Because it's almost like they went to like a fasting state in a way and their brain's like a lot clearer. And I'm like, well, I don't see any bad indications on my end. Because I know there's people that will say like, no. And then other people are like, all for it. And then I'm like, well, there's got to be both, and ors, kind of effect with it.
Definitely.
And back when you're talking about brown fat, you're talking about white fat, we're talking about the minerals. You're starting to see this shift where more people are looking at longevity, like, because I love your podcast, like that's what you're talking about, like how do you keep prolonged life? Minerals and vitamins in your supplement. What other things? Okay, so I was going to go into like the herbal. I'd rather wait for that one. But when you're talking about lifestyle changes, what are some of the big lifestyle movements that you think a person should really evaluate and change just in general for their thyroid health?
Sleep. I know people hate me when I say sleep too, because so many people have issues with sleep.
Really?
Yeah. It's huge between our phones, the blue lights, extra stress that we have these days that we didn't have 15, 20 years ago. I mean, it's an issue. And then just declining hormones too. Especially for women, they lose progesterone. That affects their sleep. Thyroid affects sleep. So it really is sleep because we know that if we are not sleeping and we're not sleeping with our circadian rhythm, we can't repair. We're going to become insulin resistant, maybe even type 2 diabetic. It's going to dysregulate everything from our mood to our thyroid function. It's going to create inflammation. It's going to hinder repair of our body and our cells. I mean, really, sleep is number one.
Yes.
If you did nothing else, but go to bed by 10 p.m., because we know 10 p.m. to 2 a.m., that's our rest and repair,
Yep.
restore time. Go to bed by 10 p.m. Oh, I can't. I'm a night owl. No, you're not a night owl. We're all human.
That's right.
Unless you're an alien, like we are all human, and nobody is built to be a night owl.
That's
You
right.
Create that. So
Yep.
our bodies are all the same. We need that 10 to 2 for rest and repair. So, okay, maybe you start off like going to bed at 11 and then you do that for a little bit and then you back it to 10, whatever you have to do to get more sleep and to get quality sleep. That's going to move the needle over anything else.
I definitely agree, because there's so much great literature and books about sleep like that. I remember there's a book called Why We Sleep. I remember the first time I read that.
Yeah.
I was like, what?
Yeah.
Like that much information from sleep. And, is it Dr. Patrick Porter? Is that right? He does brain tap. And I remember him talking about the different levels of sleep and how much repair happens at each layer of sleep. And now we're getting the Aura rings, ultra human rings.
Yep.
And now people are starting to realize, like, I'm not even getting into a state of sleep that's actually healing me, right? Is that right?
The deep delta sleep. Yeah, exactly.
With this though, and you saying we got to get sleep, get to bed before 10. I know foods are important. Like we know sugars are not going to be the best for your thyroid if you're abusing it, but do you have a particular amount of grams that you think a day? I know everybody's different, but like, okay, a person should eat this. This is a limit of sugar I see that's really the most beneficial for thyroid. This level, like I remember one doc, I read this book and he was like, nobody needs more than 5 grams of sugar a day. This is what this one doc, and then other people say, no, 12 to 15 is okay. And then some people say, no, higher carbohydrates okay if things are functioning well. Do you have any idea like what you would recommend or you like to recommend in that area?
So I think we have to break it down into what type of sugar it is. So we can say sugar, and then we could talk about high fructose corn syrup on the one hand, and then that's going to be a 0. Yeah. And then we can move over here and say, well, what about fructose from fruit? Mm-hmm. And then what about even, lactose, if you can tolerate dairy in the form of like hard cheeses or something like that, or a nice fermented Greek yogurt.
Yeah.
So it just depends on the source of it. But I always say your labs tell us how you should eat. So if you are type 2 diabetic, insulin resistant, and you really have a problem with carbohydrates, and maybe you're wearing a CGM and you're seeing that, yeah, I love my organic blueberries, but I eat them and it spikes me to 180 on my CGM. Well, then that's not right for you. So you kind of have to find your sources of carbohydrates, preferably the complex.
Yeah.
Preferably the complex carbohydrate. But even then see how your body responds to it.
Yeah.
So I can eat a sweet potato. I love sweet potatoes as a carb source. But you could take someone else like, oh my gosh, if I eat a sweet potato, I'm 5 pounds heavier the next day.
Yeah, that's true. Yeah.
Okay, well, figure out what sources of carbohydrates are for you, and then figure out your macronutrient count. Like how much? Okay, so if your insulin is, let's say, 14, I like fasting insulin below 6.
Yep.
Your insulin's a 14, your A1C is a 5.6. Your doctor said you're not diabetic, but we look at them and go, yeah, well, you got a problem here with your sugar.
Yep.
So am I going to tell you, oh, you know what? Go ahead and eat all the carbohydrates you want? No. I mean, we know that carbs create an insulin response and a glucose response.
Mm-hmm, mm-hmm.
So let's pull those back. So if someone's on, let's say 100 grams of carbs a day, okay, let's take you back to 50 and see how you do. Bring up your protein, throw in some more good fats so you're satisfied, and let's dial back those carbs. And then we can do carb cycling and whatever. We can figure out how to add more carbohydrates into your diet after you get to your goals, after you reverse that insulin resistance or diabetes.
I love it. I love it, because one of the things that I've always had a little bit of discrepancy with my patients is like they'll ask me about how much, doc, should I eat or how much should I take in? And I do believe in the different forms, because what do you think about like even with certain food types creating like allergy responses? Okay, so sometimes they'll eat a food which I would expect like this should not raise their blood sugar. And you're like at the blueberry and you're like, what the heck? That shouldn't do that. And I'm not trying to sound smart, then you may find something in the blueberry that they possibly couldn't metabolize or something of that sort. What are some of your main like foods that you've seen, like, not saying you had to totally stay away from it, but are there ones that usually hurt the thyroid that you would recommend to stay away from?
Well, so for those foods, they don't necessarily spike glucose, but they're called goitrogenic foods. So that's going to
Yeah.
be the cruciferous vegetables,
Uh,
which is like, wait a minute, vegetables are great. Yeah, they are. Just don't eat them in the raw form. So broccoli, cabbage, cauliflower, those cruciferous vegetables are called goitrogenic, and they can actually cause the thyroid to not work as well. They can create a goiter, which is a growth on the thyroid.
oh,
They can hinder how your thyroid hormone replacement that you're taking to get optimized. They can hinder how that works.
really?
So, I get it. Okay, you love your broccoli, just steam it, stir fry it, really cook it down and let that compound break apart, break down that goitrogenic compound. Then you can better take it in and it won't create havoc in your body.
That's like, it's big because, I mean, where my office is at, right across the street, there's this beautiful organic market. And I mean, they serve great food. And sometimes like people will come to me and they have the best food, but certain body types, when I do some of the testing, I'd find that, you can't do a lot of broccoli or you can't do such and such. And they're like, what? Like I eat it every single day. And I'm like, well, it's kind of probably not helping the metabolism right now. When you start to heal the thyroid, to give people hope, do you see it where you could eat some of those foods, or you can metabolize sugar when you start healing this area up?
Oh, yeah.
Really?
Yeah. I always talk about living in optimization land because that's where I'm at.
Mm-hmm.
And it's a beautiful place to be. I welcome y'all to join me here. But no, it's really, it's a place where you're so metabolically efficient. Yeah, I can have a little bit here, a little bit there. I can have the gluten-free pizza. I can have a little bit more sugar over here. I can have even the goitrogenic vegetables, but I prefer not to eat them raw anyway, so I'll cook them down and stir fry them. But
Yeah.
you can get away with a little bit more because your metabolism is working as it should, and you are essentially a fat burner, not a sugar burner, so you're metabolically efficient. And then you can have those little things. But when you're in the beginning of your healing journey, I say, listen, let's focus on your goals. What are your goals? To ultimately be more healthy, to lose the weight, to become more metabolically efficient. Let's not screw around then. Let's stay the course in the beginning to really heal your body. And then we can explore with going outside the lines a little bit.
I love this. Because when you think about all the things that we could incorporate to thyroid health, one of the, I love having the components, like you were talking about the emotions, the chemistry, the structure. What would you say too? Like we monitor what we eat, we're taking the right things. Like there's a big movement of people using organ meat, glandulars, thyroid. I had a patient, this is well over 10 years ago, and she was on different thyroid medication. In no way am I saying you stop taking your thyroid medication. I'm saying that she had to start taking thyroid glandulars along with their medication, and she worked well. She goes, I can't believe it. Like it turned on. What's the thing with glandulars?
Okay. So glandulars. So let's actually back up a little bit and look at thyroid medication so we can bring in the glandulars.
Yep.
When we look at thyroid medication, we have the natural desiccated thyroid. So that's your Armour and your NP.
Okay.
So that's literally derived from drying out a pig's thyroid gland. That's the OG medication for thyroid. That's like back in the 1800s. That's what we started with. We took a pig's thyroid gland, we dried it out, we gave it to people with a thyroid problem, they got better. Okay, woo, yay. Now comes along Big Pharma and Synthroid. And now it became in conventional medicine, well, T4 monotherapy does just fine. All you need to do is prescribe some Synthroid or Levo and people will be good. And that took over the NDT. So now we see so many people on T4 only. And here's a stat for you. Only 2% of the population with a thyroid problem do well on T4 only. 95% of us need T4 and T3 or T3 only. What's one of the most prescribed medications? T4.
That's exactly right.
T4. I mean, that's what they do. It's standard of care is let's test your TSH. If TSH is above that limit, then let's give T4, patch on the butt, send you on your way. We'll see you in 6 months.
That's right.
And people still suffer with symptoms. So I'm betting that your patient was on T4 when she added in the gland.
Yeah, I guarantee it was. That was, yeah.
So now we have the supplemental thyroid glandulars. These are derived from drying out a cow's thyroid gland. Very, very similar. Now, it is said in the supplement community that the glandulars don't contain T4 and T3. Yeah, they do. Because is there someone picking out the thyroid hormone from the glandular? No, it's naturally occurring just like it is in an NDT medication. So your patient added in a little bit of T3 to her T4.
Oh.
That's what made her feel better.
And she knew, that's exactly what had happened.
Yeah.
Wow. What, they're hypo and like really on a hyper, like if somebody had hyper, there's some discussions like my mom's been hyper before, you know, hyper.
Okay.
And so they would say they'd increase a little bit because her TSH levels were so low. And then they would give her like a little T4. And they said, no, we're never going to give her T3 or anything of that sort. What do you think about that with hyper? Like, don't give her T3, or just what's your recommendation for people going to hyper?
Well, there's two categories we have to talk about. Number one, was she really hyper? So a lot of people get diagnosed hyperthyroid instead of hypo. So hyperthyroid when their TSH drops down low. Now, let's back up. TSH is a brain hormone. It's a pituitary hormone. It's not a thyroid hormone. We can't diagnose someone hyper based on the TSH, because if your mom, let's say, was on T4 before, any kind of thyroid hormone, and I've seen this in very healthy people, that TSH will drop and they'll get told that they're hyper. And I go, well, wait a minute, let's dive a little bit more. What's your free T4? What's your free T3? And how do you feel? And let's test for Graves antibodies, which Graves is the autoimmune form of hyperthyroidism.
Yep.
If all of those check yes, so if your mom was anxious, sweaty, insomnia, losing weight, itchy eyes, and her TSH was low, and her free T4 and free T3 were elevated, I would say we have a hyper situation here. But what if she wasn't? You know, so did anyone look at her free T3 and free T4 and actually see what those markers were? How did she feel? We have to put that all together. So if someone truly is hyperthyroid, yeah, we don't give them thyroid medication. We try to calm that system down, support their immune system. We might even use something, which I don't like to, but we have to in certain cases, methimazole, which slows down thyroid function.
Yep.
If someone truly is hyper, like the eyes are bulging, they're wasting away, they're sweating, they're anxious, all the things. But that's really where I encourage people to listen to their body. Because if you're told something by your doctor and you're going, wait a minute, you're telling me that I'm hyper, but I just put on 10 pounds last week. I'm depressed. I can't think. I'm sluggish. Nothing's happened. That's hypo.
Yep.
Someone is misdiagnosing you.
That's what, because I was reading a book about iodine at one time, and they say most people who are are hyper, really hypo before they show hyper, because the same like with my mom, she had Graves, but she really doesn't have bulging eyes. She really never had sweating. And so whenever I give her a thyroid glandular, people say, what? I was like, no, she actually feels better when you give her those things. And you know, I'm not trying to like bump the status quo. What I am saying is like, really think about it and find a practitioner who would think that way.
Yes. Yes. The thyroid gland is so nuanced.
Yeah.
And I think, well, number one, in conventional medicine, they haven't really dove into the thyroid gland as well as they should in med school. And they are being taught the standard of care. Test TSH. If TSH is high, give T4. That's it. That's all you have to do with the thyroid. Meanwhile, this was years ago. I gave a talk to an integrative wellness physician group.
Really?
And they wanted to bring me in to talk about the thyroid. So I talked about the testing and all the importance of. And then I talked about being in the Synthroid box. And I said, why are we in the Synthroid box, T4 only box? I said, if you had a patient come in and they were depressed. And they were on an antidepressant. Oh, doc, this isn't working. All right, let's try another one. Let's try another one. Let's try another one. Let's add on a benzo. Let's give you a sleeping pill too, and anxiety medication. You'll give them this slew of pharmaceuticals to calm down their depression. Someone's hypothyroid, you give them one med. I go, why is that? The doc raises his hand and goes, that's all we've learned. So that's all they're learning in med school. The thyroid is a nuanced art. So when I get asked, well, what's your favorite thyroid medication for people? I go, the one that's going to work for you, in the combination that's going to work for you, in the dose that's going to work for you. There is no one size fits all. There is no favorite. It's about you and your biochemistry and finding exactly what you need to get your numbers pretty. Yeah, we want those optimal, but ultimately I want you feeling your best. So if your practitioner is stuck in the Synthroid box, and if your practitioner is not asking you the 4 most important words that they can ask, how do you feel? You need to turn around and walk out and find somebody new. Because it's about how you feel.
Perfect. I'm serious. I'm gonna send you my mom's stuff. I'll have her work with you. This is crazy because in my own realm, like I'll do some work with mom, and I'm not trying to just talk about my mom. I'm thinking like people out there in general that have thyroid issues. And it is such a crazy, not a crazy thing. What am I saying? It is such a hard thing to hear how people just feel crummy. Like they literally feel crummy, like with thyroid issues. And one thing, when you say you find a practitioner that can make the levels meet, there are a few practitioners I found in the area I am where I'm so grateful that they've taken all their thyroid meds and even like estrogen, hormone replacement therapy, and they care and they'll modulate it. And that person's like, I never want to get off this amount in this section because my practitioner found out I had too much estrogen. I had to do this much wild yam cream. I had to do this. And I'm like, whatever you're doing, stay on it.
It's working.
It's truly that way. Is that how you like? I know you like to work that way, and you just sort of like how do you feel?
Yes, that's exactly it. It's pulling those levers and tweaking it and really customizing the protocol to that individual. It's so important. And really in today, I don't know if you see this as well, but thank goodness we have more functional, integrative, thinking outside the box practitioners, but it's also become a marketing art.
Really?
A lot of conventional doctors are saying, hey, I do functional medicine. So instead of running it through your insurance, pay me. And these poor people are going because they have functional in the title and they're thinking, I'm going to get better care here. And they're not. They're still being treated like they're in the conventional system. Now they're just paying. You have to work with someone that specializes. Like I specialize in thyroid hormones. I don't claim to be a cancer specialist. I'm not a gut expert.
Yeah.
I'm not a heavy metal expert. I'm a thyroid and hormone expert, and that is where I am going to focus. And yeah, of course, we're looking at metabolism and insulin and nutrients, like you said, and lifestyle. But if you go to a functional practitioner that's a FC bar expert, you're probably not going to get treated for thyroid and hormones properly. You know, they're going to focus on your EBV, and that's awesome, and that might help your thyroid. But they're not. They're just going to treat your thyroid and hormones like they learned over here on the side. That's not their specialty.
See, that's like one thing I've always been concerned about is, and not naming any names. I've had some practitioners I've never heard about in our area where they would find like a level, like when the thyroid hormone or a hormone level was deficient, and they would just throw as much as they could, like, you know, because they would say, well, the estrogen is this low, and I'm going to give you this much estrogen, and it would be such a high dose. And those patients come in like, I am having hot flashes. I'm having, you know, problems down reproductive area. And it would just take, I always wondered why wouldn't they just sort of modulate it slowly? Like, let's go. But I think maybe, is it because there's so many people they may be seeing that's just, they're just hurting and they're like, I just got to do what I got to do to get you feeling better? Or
yeah, I don't know. Maybe, I mean, I'm all for aggressive treatment, but I like to ramp up to that. Like, I'm not the cap, you know, I'm not walking around saying, oh, well, I don't go above, you know, 50 micrograms of T3. It's all about what works for you. But I think maybe they're just trying to be aggressive to get the person feeling better quickly. And that's great. But like you said, they could feel worse. And maybe that's all they've learned is a cookie cutter approach. A lot of online clinics popping up now, hormone clinics, that they just do the same thing for every single person. That is a huge problem.
yes,
Huge problem. You have to know how that person tolerates hormones. Look at their age. How long have they been in menopause without hormones, or are they just starting? Or it's so nuanced.
I'm with you. And even when patients will come in and they'll have like adrenal overload, or if they have like kidney issues with Chinese medicine, like it's not one cookie cutter avenue in Chinese medicine even. It's like everybody has to have their own singular way of how they need to be treated. And I think it can, you know, the practitioner it's a big job, and it can actually fatigue some practitioners, you know, because they're like the ones that are really nuanced. And I'm with you. I have seen it where a lot of practitioners are saying I'm a functional medicine practitioner. And then when they do go to the practitioner, it's like, they really don't really analyze it in like that functional medicine aspect. See, I didn't know that. That's good to know. Okay.
I saw someone last week. She showed me her labs. I love looking at labs. I geek out. And she showed me her labs, and she's like, yeah, this is from my functional practitioner. Did not even test the reverse T3. I'm like, how is this person using the term functional when you didn't even test reverse T3, which we all know is one of the most important markers in our functional world?
Yes.
We know that. Are they still really in the conventional world? Because I'm thinking so.
I agree. And I think that we have to be really careful. And I'm so thankful, like with the information when you put out there about every angle. One of the things too, I like with your podcast as well, is you delve into and you talk about, I'm not saying the emotions, but how much do you well, I don't say light, but how much do you see with, maybe I get a little woo-woo. Okay, so don't think I'm too woo-woo.
Little woo.
You know, a little woo-woo about like chakras and energetic medicine. Because some people call the thyroid like the throat chakra, about what, like not having a voice.
There's something to that.
Really?
There's something to that. Now, I have not gone down the deep rabbit hole of Chinese medicine, chakras, all of that, but that is a common symptom.
Really?
And it's very, very interesting how it's tied to the thyroid. Yeah, trauma, not having your voice. Like maybe you were suppressed as a child. You weren't allowed to complain. You weren't allowed to express your emotions. You weren't allowed to cry. You know, you had to be strong from a very early age, or even now. I mean, you're in a relationship where you can't express yourself, or you're in a job where you feel stunted and muted, and that's big.
That is big.
That is big.
When you start to see that there's that discrepancy about like emotions and their physicality, they start losing their hair. Now I love it with your application. So you have your supplements, and I love asking, like, do you put both supplements in at the same time, or do you, like, you know, with metabolism, with thyroid, or how do you like to intertwine them?
I like to really customize it. So the thyroid fixer and metabolism fixer both contain T2, but metabolism fixer, what we added in there is suppressive because of all the food noise and the cravings out there and people jumping on the GLP bandwagon.
Yeah.
I wanted something that was natural. So this is a saffron extract derivative that has multiple studies behind it. I dove into the research first before I put it in. Multiple studies showing a significant, like 67% reduction in cravings and food noise and appetite control. So it's not eliminating your appetite like a GLP. Now, I've tried the GLP on myself because we like to experiment on ourselves sometimes.
All the time.
Just so we can give feedback to people, right?
Totally do it, yeah.
And I took a regular dose of a GLP, literally this big, beautiful steak. I took 2 bites of it. I'm like, I can't. Like, I cannot take another bite. That's how it just destroyed your appetite. Well, the problem with that is now I'm not going to get in the protein. I'm not going to be able to protect my muscles. I'm not going to be able to repair. I need to eat in order to get that protein in. So it's all about taking the edge off the craving so you can control your carbon, sugar, and bad food, processed food intake, and really want and crave the healthy food. And that's what Suppressa does. So if someone has that issue with food noise and cravings, we'll go to the metabolism fixer route. If they're like, you know what, I'm good in that area. I'm doing everything right. My diet is clean. I'm taking out the processed foods. I have really good appetite control. It's just my damn metabolism. It's too low. I just can't lose. That's when we'll say, all right, add in thyroid fixer.
Wow. See, I love this. I love components. How to, like, 1 + 1 will equal this. Because I've also heard, like, with saffron, I'm so impressed with saffron over the years about women's hormonal health. It fixes a lot of the brain anxiety. Like some patients, and this is not me patting myself back. I literally had a patient that was over anxious. They did have some thyroid issues, and they said, hey, I just started they came in and they weren't as anxiety ridden anymore.
Okay.
And they were like, oh, I just added in this thing called saffron. I was like, oh, like this is a while back. And I was like, well, it seems to be working. And that makes total sense because they said that some of their thyroid levels were getting better. So saffron's in the mixture. This is great. Okay, so everybody should be specifically addressed. Everybody has their own bio individuality. And I hope that's how, my practice goes, like, basically. And you're doing virtuals. What does a virtual look like for you? Like, do they jump on and do they do like a pre-screening? Because I like people to hear it because I want them to work with you. But how does it go with your process?
Oh yeah, well, we test first. So we get all the big testing done that we want to see. So we have that in front of us along with your intake form so we can really pair up and get to know you. So it's about how do you feel, your symptoms, family history, your lifestyle, all of that. Now we flip over here to your labs. We look at what supplements you're taking, what meds you're taking right now. And we spend 90 minutes with you right in the beginning because we want to paint that whole picture of, okay, what does this look like for you? What do we need to address? What hormones do we need to add in? What do we need to change with your current thyroid medication regimen? And then let's move over here and let's look at what you're putting in your body and on your body and what your day-to-day lifestyle is. And now let's design a program that's going to address it all. Now let's hold your hand through it and guide you through it and meet with you every single month and give you access to us. I'm a firm believer. I don't like those practices that are like, all right, we'll see you in a month. Save all your questions for next month. like, wait, what if 3 days from now I
Yeah.
start to bloat or have headaches?
Yeah.
I want to be able to reach out and ask that question. Like, what should I do? Is this normal? Do I just need more time on this? Whatever. I want that communication line open with my patients. So we allow our patients to do that. And then we retest, make sure we're on that right path.
Yeah.
And then make changes as we move along, because it's all about tweaking. It's not a one and done.
Yeah.
It's not like we get this question all the time. Well, can I just meet with you one time? And like, that's not going to do anything, because we could start with one protocol, whether it's thyroid hormones, whatever, and then your body adjusts to it and shifts. And we need to make little tweaks as we go. I mean, to your point, you asked earlier about these practitioners that just start off on a high dose, right? So I'm on 150 micrograms of T3. I'm T3 only. I split it 75 and 75. If I gave that dose to a person starting out, they would have a heart attack. I didn't start there. You can't start there. We have to start slowly and build up.
That's perfect.
So luckily, back in the day, I was working with someone that knew what they were doing. And I started slow. I would like increase a little more, till I found my sweet spot dose. And that took about a year.
Wow. I love that. I love that people know it took you a year to find that sweet spot. So don't give up. Keep going. Man, this has been really good. I love this. Is so good. This is so fun. When people start to see this, I like to get in a well-rounded aspect, and we can have you on again because I like to talk about more things thyroid. I mean, there's a lot of thoughts in my head, but I don't want to overwhelm everybody. But one of the things that I know that when we talk about hormonal health, we're talking about the biochemistry. I want people out there too to realize, like, if they feel overwhelmed and their emotions are changed, this is one aspect. Do you find that people that do have the low thyroid and they're going through this, they're coming to you? One thing I've seen, because in Chinese medicine, thyroid has a lot to do with what they call fire remedy, fire element.
Right.
And it's like passion and drive and direction and focus. Is that a big thing in your world too? Like, you find like people who have thyroid, they just don't have focus or passion at all?
Well, they lose it. They might have had it before and they feel like almost like their body is rebelling against them. Like they're not the same person anymore. They've lost themselves. So you said earlier about losing your voice. It's almost like they've lost who they were and who they know they are. That passionate person with drive. Where'd she go?
Yeah.
Where'd she go? Because now I'm just seeing this frumpy woman in the mirror that has no drive, doesn't want to do anything. And it really starts affecting, I would say, thyroid issues and hormone issues really start affecting your relationships. And they do, because it's so hard to tell your partner or even your friends, I don't want to do anything. I don't want to get dressed because everything is tight. I don't want to do my hair because it's falling out. I don't feel good about myself. I don't even have the energy to go out. And then we go out and what? You're going to get an appetizer? All right, well, I'll be 5 pounds heavier tomorrow. Glass of wine, I'll be 10 pounds heavier tomorrow. Then I'll be bloated and I'll hold 5 pounds of water and won't be able to lose that until next week. And then I'll have brain fog and a headache. I'm just going to stay here and watch Netflix. You know, I mean that. And then people around you are like, what's wrong with you? Suck it up. Let's go. Let's go do something. You don't want to do anything anymore. That really starts to create a lot of friction and tension in any relationship that you're in. And then I joke one step further, but it's actually true. I had a woman come up to me yesterday and go, you know what you said about making money is true. You can make more money when you fix your thyroid. Why? Because if your brain isn't working, if you're not focused, if you're not concentrating, if you don't give a crap about your job anymore, whether it's your business that you're running or you're working for someone, that lowers productivity. You make less money or your company makes less money, whatever it is. It really, I mean, it's amazing how the thyroid and hormones affect every area of your life.
Every area. Because you can see that if you do fix it up, your passion could come back, your direction, where you focus your energy, more productivity. And I think that individuals, it's really funny. I think that when people have gotten their thyroid levels up to par, they always say like, you know what, I'm really good at having focus and I can get tons done in a few hours.
Yes.
And then I listen to my body and I realize that my thyroid's sort of like speaking to me saying, okay, you're good for the day. Like, you know, you did 3 hours of good work, 4 hours of good work. You're more productive in this 3-4 hours than you are the whole hour, 7-8 hours trying to like kill yourself.
Right. Exactly. Yeah.
Oh man, this is so good. Okay. Because this is a lot to chew on. I know people are going to be, I know how you know with your podcast that people are going to sit there and go, this is a lot to chew on. This is such a good combo. It is. We need to do some more. Like, I want to talk to you more about, if we can at some point, I like in person the best, but even if we do something about how you see more of the infection routes, I'm saying like we can get into a good discussion because I just have some good thoughts I want to run past you too. That'll be good in the future. Okay. So how can people find you? I mean, I know where I find you, but they don't know, like maybe like what's your Instagram feed and your website and how they can get a session with you.
Absolutely. So if you go to dramie.com, DRAMIE.com, on there, you'll find the link to my podcast. You're definitely going to be on it. We got to continue this.
This is so fun. Oh
so Thyroid Fixer podcast, there'll be links on there. It's on all podcast platforms. And on dramie.com, you can go to the shop. If you're interested in Thyroid Fixer, Metabolism Fixer, you can book a call. So booking a call, we're going to talk to you about your journey, what you've done, what you haven't done, what your journey has really been like. And that way we can find that right program that's right for you, where we can prescribe to you, order all the labs, do all the things.
Oh, man.
And then social, all the socials. Dr. Amie Hornaman on Instagram. I do have a Facebook group as well. So that is called the Just Fix Your Thyroid Facebook group. And it's a fantastic place for people to jump in. You can post your labs. I'm in there answering questions. My nurse practitioners and coaches are in there answering questions. We really support people in there. Even if you're like, I don't know, do I have a thyroid problem? I have these symptoms. My doctor told me I was normal. Jump in that group and get support. You'll get answers in there as well.
I think the best support, like in that community style, is that when people have similar issues or concerns and problems, community support is where it's at. And I know I can tell by your energy, people feel supported. So I'm just so thankful we got to meet, and it's great. Like when you have camaraderie and just like if I have a hard problem with the thyroid, I'm not going to try to do it. I'm going to send them to you. So this is great. So, okay. Yeah, we got to continue this talk.
Yes.
I am trying to get myself on your podcast, but it's going to be great. Anyway. Okay. So, we're going to have a great rest of the day. And guys, we are so thankful for Dr. Amie here. And if you guys have any questions, any more concerns about thyroid, please contact her. Please follow her. And, when we come out with this podcast, we'll have some notes in the show notes, the caption, so you can get a hold of her. And from all of us here, we're really thankful for you. If you like this kind of content and you have more questions about thyroid, please contact us or put some comments in there so that we can actually refer them over to Dr. Amie. Until next time, thank you, Dr. Amie. All right. We'll see you guys. Have a good day.